Hi everyone, I'm Dr. Blake Staub from the Texas Back Institute. I'm a neurosurgeon specializing in complex revision and deformity spine surgery. If you or a loved one has had previous spine surgery and either failed to get better or actually worse after spine surgery, then you probably need to see a specialist like myself. There are very few of us around, but I really am a revision spine surgery specialist. It's not normal to have back or leg pain that's either the same or worse after spine surgery, and oftentimes there is a surgical fix. So if you have chronic neck pain, chronic back pain, are told you need a second spine surgery, or sometimes even if the original surgeon tells you, yes, you're in pain, but there's nothing else to do, then please give us a call here at the Texas Back Institute. We'd be happy to look over your case at no cost. I'm happy to review your imaging, any clinical symptoms that you have, and let you know whether or not I think I could help with more surgery. Sometimes it's just physical therapy or injections, but oftentimes we can make you a lot better by revising what has gone wrong the first time. My mission in life is to really take complex spine cases and find the best solution to those problems and really get patients back to living. Complex spine surgery is really any spine surgery that's not a simple decompression operation. If you have a small laminectomy or microdiscectomy, really minimally invasive surgery to decompress nerves, that can be done by most spine surgeons. Once we get into more complex spine surgery, whether it's someone who has scoliosis or is having a fusion revised or a fusion for the first time, you really should seek out a specialist in complex spine surgery. These are bigger surgeries that involve more planning, they're more intense and more involved. You really shouldn't see someone who doesn't do these surgeries all the time. Complex surgery, is different because trying to revise a failed fusion operation or a screw that's in the wrong spot leaves us with fewer bailouts. It's a much more complex fix and it takes more preoperative planning to really understand how to solve the patient's problem. And many surgeons don't take the time necessarily to really dive into where exactly the pain generator is and what the best, least invasive way is to treat it. Don't let another surgeon or another pain management doctor tell you there's nothing else that can be done. There are numerous spine surgery specialists around the country, myself included, who can revise these problems that didn't get fixed the first time or were in fact created by a previous surgery. It's really important for patients to understand that when a surgeon offers you even a 1 or a 2 level minimally invasive fusion operation, oftentimes that's the right answer, but if done incorrectly, it can lead to lots of downstream effects that requires a complex spine surgeon to fix it in the future. So it's really important when you're choosing that surgeon to perform that delicate operation that you choose someone that truly understands the biomechanics of the spine and proper nerve decompression to make sure that you end up with the correct surgery so that this doesn't turn into a complex or a revision situation down the line. So there are numerous different types of complex spine surgeries. There's revision situations where someone had another surgery and potentially there are screws in the wrong spot, maybe a rod broke, or there's a spacer that was put in that has moved or was put in the wrong spot from the get-go. That's a whole bucket of revision spine surgery. There's also complex spine surgery that happens the same way any degenerative process happens in the spine, the same way you'd have knee arthritis or shoulder arthritis. The same things can happen in your spine, and sometimes they progress relatively quickly, leading to either scoliosis or deformity in the spine where you can't stand up straight or your head falls forward. Really big surgical solutions are required to solve those big problems. So oftentimes with failed spine surgery, patients can have a myriad of different symptoms, whether it's residual, chronic neck or low back pain. Sometimes nerve pain was never fixed, or it's actually even worse after surgery. A lot of times patients can't stand up straight. One of the most common things we see is a patient who stands very pitched forward because their spine was fused too flat the first time. That's where the original surgeon typically didn't take into account the patient's overall curvature of their spine and didn't give them the lordosis or the proper curve in their low back, leading to a complex situation where they just can't stand up straight, or sometimes are even tilted way off to the side. So there are a ton of reasons to have back pain or neck pain, arm pain, or leg pain after spine surgery. And like I've said before, there's a myriad of solutions to those problems. Sometimes it's simply you need more physical therapy. Occasionally you need an injection or some other conservative treatment to get you over the hump of surgery. Unfortunately, sometimes with complex deformity revision spine surgery, we really have to bite the bullet and do another surgery to really right the wrongs from the first episode and hopefully get you back to walking and standing up straight again. Any spine surgery is fraught with complications. Even the best surgeons have occasional complications because we're operating on the human body. Nothing's perfect. That being said, it's really important for the surgeon to recognize the complication and treat it appropriately right then and there. Some of the surgeries I treat become complex because the original surgeon didn't necessarily either address or recognize the initial complication. One such complication we oftentimes see is a spinal fluid leak. This can happen during any type of spine surgery. It really can happen up to 5% of the time is what's reported nationally. Again, the most important thing from a surgeon's perspective is addressing that problem right then and there, as it's the easiest thing to fix up front. As a complex revision spine specialist, I end up seeing a lot of patients who have this problem and it hasn't been addressed. And it's been treated with Band-Aids over and over and over again. And by the time it reaches me, it's a much more complex issue. Luckily, we've had a lot of success fixing that really complex problem. If spinal fluid leaks are not fixed the first time, it often requires a complex solution in multiple surgeries to get it right. Symptoms of a spinal fluid leak after surgery include things such as a headache, dizziness, or even sometimes leaking of clear fluid through the skin. I oftentimes see patients that have had other spine surgery that was complicated by a spinal fluid leak, and the previous surgeon was able to get the skin to close and everything healed up on the surface, but there was still a problem deep down and the patient was still very, very symptomatic with headaches and dizziness and nausea and vomiting that couldn't be fixed by the primary spine surgeon. So that's when I take over the care of the patient and we do some complex remedies to close that hole, stop the spinal fluid leak, and really ameliorate the symptoms the patient's suffering from. We've had really, really good long-term success by getting those chronic leaks healed. There are a ton of spine surgeons out there. In Dallas alone, there's over 200 spine surgeons. But we're not all trained exactly the same. There are some spine surgeons who only do super minimally invasive, 1 hour surgery for nerve compression. There are others that only treat, 1 or 2 level degenerative processes. Not everyone's trained to do these giant reconstruction surgeries because the preoperative planning, the intraoperative execution of that plan is so complex. We have to take into account so many variables to get that surgery right, and many surgeons either don't have the time or the acumen to really develop that plan and execute it in the operating room. So if you're going to have any spine surgery, but especially a second or third or fourth spine surgery, you want to make sure you choose a surgeon who specializes in complex revision and deformity spine surgery, as that's the person who's most likely to either right the wrongs of a previous operation or finally get you back on the path to recovery. It's my mission as a complex spine surgeon and a neurosurgeon to solve problems that patients have been dealing with for years and get them walking, standing up straight, and without pain. If you've suffered or a family member have suffered from prior back surgery that hasn't exactly gone as planned, please come see me in the office. Send me your information over the internet. We will gladly review everything for free and get back to you, because there's so many patients out there who I feel like I can help who aren't necessarily being offered the care that they deserve. So whether you're having a 1-level fusion operation in your back or a 10-level fusion operation, it's really important the surgeon get everything right. If the surgery is not done correctly the first time, it leads to a cascade of events that results in numerous spine surgeries in your future. So the way I avoid that situation, even when I perform a 1-level fusion operation, I get specialized x-rays of your entire spine. I can then take 20 to 30 different measurements based on that x-ray to make sure I build the perfect amount of curvature back into your spine. I work with a national company to build custom rods that we use during fusion operations that will specially fit not only your spine, but exactly where I want your spine to be and what I want it to look like. Without this preoperative planning, it's simply a guessing game, and not every patient is the same. Not every patient needs a 16-degree spacer at the bottom level and a 12-degree at the next one. everybody's different. And so when you walk into my preoperative holding area prior to surgery and you ask me, okay, Dr. Staub, what spacer's going in L5S1, I can tell you the exact angle that I'm putting in at every single level of your spine because I've done all those measurements in advance. If your surgeon can't answer that question for you, you're probably seeing the wrong surgeon. So when we make these plans, every plan is specifically tailored to an individual patient. I get these full body x-rays and I'll make measurements custom to you. I don't rely on generic measurements that are the average for each person because everybody's different. For example, the average curve in the low back is somewhere between 40 and 60 degrees. But that means some people need 30 and some people need 70. And the person that needs 40 shouldn't have 60, right? So it's really important that we build in the exact amount of curvature you need, as there's really, really good scientific data that if we as spine surgeons get that wrong, it's gonna lead to a revision surgery within a year. As a patient, as a consumer, you look at someone's resume and they went to medical school, they did their fellowship, all these different things, and they seem great, but it's hard to know who really is good. As a fully trained neurosurgeon, I also wanted to become a specialist in spinal deformity surgery. So I did a year-long fellowship at the Hospital for Special Surgery, learning from some of the greatest deformity surgeons in the world how to perfect my craft. So when you're seeking out a revision spine specialist, it's really important to ask about their training. Was it mainly minimally invasive focused, or was it more deformity and revision focused? How much of the spine surgeon's practice is based on, revision and deformity surgery? You want someone who does at least a fourth of their practice in complex spine surgery. I know here at Texas Back Institute, I see patients from states all over the United States and from countries all over the world who come here for their complex or revision spine surgery needs. It's a large portion of my practice. We've tackled almost every complex problem you can think of, and I'd be glad to help you with your problem as well. Again, feel free to send me your images. I will gladly look over everything and see if there's a solution to something you've been dealing with for years that's caused you or a family member great pain. A lot of patients I see have either a degenerative or what's called an iatrogenic scoliosis, meaning a scoliosis that started off when they were a kid. Many times a young woman who's in her teens or early 20s can get diagnosed with scoliosis, and it's something that doesn't get fixed. Either they get put in a brace or it's simply not bad enough that, that we can just simply watch it. Well, those women turn 30 and 40 and 50 years old, and eventually the normal degenerative processes take hold, which can lead to worsened back pain, worsened leg pain, and a worsened curvature of their lower mid-back. That's where I step in as a scoliosis expert. We spend a lot of time here at the Texas Back Institute measuring, coming up with a perfect solution, and then executing that plan to solve patients either degenerative, meaning kind of progressively getting worse with age scoliosis, or scoliosis that was there as a teenager that has then progressed. The solutions are often very similar. Unfortunately, oftentimes it requires surgery, but we try to get people by with physical therapy, injections, and other conservative means. But when it comes to surgery, we're experts at fixing scoliosis. Sometimes we can do that through a very small incision. When a big scoliosis causes a little bit of nerve compression, it can cause severe leg pain. That doesn't mean you need a big, giant scoliosis operation. So if a surgeon recommends a surgery this big for your leg pain, oftentimes I can sneak in with a surgery this big and fix all of your problem. However, sometimes a deformity is bad enough, pain is bad enough, that we have to do a really big operation to get you better. That being said, we have a very, very high success rate and a very, very low complication rate doing these really big surgeries on people in their 50s, 60s, 70s, and sometimes even into their 80s. We as spine surgeons have gotten very good at treating people in their 70s and even low 80s with really big spine surgery. We've made great improvements with anesthesia, with post-operative care, with pre-operative care, to get even people that are a little bit older through a really big operation. So, don't think you're too old for this surgery. Don't think it's something that's beyond repair. That's why specialists like me exist, to get you through complex situations like that. So my mission in life is to get you out of pain, get you standing up straight, and more importantly, get you walking again. Too many people are inactive, they're sedentary, they can't do the things they enjoy in life because of either horrible degenerative changes in their low back or unfortunately failed back surgery. Regardless of where you are in your life, whether you're 20 years old and had a few bad surgeries or you're 75 years old, please let me try to help you. Just send me your images, make an appointment to come see me. Let's come up with a plan to get you better. There's no point of just waiting until you're actually, too old or too sick to fix these problems. Let's solve it now while there's still a safe and effective way to get you better from a pain perspective, from a posture perspective. We need to get you back to enjoying life.